This is Brooks Lambier. We're back again with Dr. Zach Atwood and Spencer Nolff of Primal Recovery. This is the first episode of our wonderful series with them. There'll be plenty more. We're going to cover how Zach and Spencer are just how they can help, but also what you can do to help prevent an injury before actually sustaining the injury. So, welcome back, guys. How are you?
Doing
Doing
great.
well. Thank you.
Um, Zach, well, how about you start with this? So, we can talk about a lot of different things, sleeping patterns, what you eat, stress, there's a whole bunch of ways we can go about this. Where do you want to start? And start us off, bud.
Yeah, I'll kind of start with just going to the point of what we're trying to do here with the trying to get ahead of it, I would say. One thing I'll flat out say from the beginning is we're never going to preach or tell you that we can prevent an injury by, 100%. We
Mhm.
like to say we can reduce your risk of an injury happening, but to flat out say like, oh, this will prevent you from ever tearing your ACL, unfortunately, it's not possible. There's just so many factors that go into it. And it'd be very naive for me to say like, yep, I can prevent that from ever occurring. So I'll start with saying that, just to get it out there. But yeah, just to the point of what we're trying to do here and trying to get in touch with a lot of different teams, coaches, organizations is we're trying to get ahead of the game by screening players through different types of tests. So we have equipment at our facility that we will bring to teams and actually do it at their field and their court or whatever it is. We have force plates, which basically are what tells us when you leave the ground and when you land the ground. It gives us these different metrics, which kind of again, bring up is it normal? Is it abnormal? Is it something we should care about? Is that just a normal thing, that a typical, 14-year-old would be at? Um, so we try to take a different lens for things that you just can't see with the naked eye. And then we'll also run people through a bunch of strength tests. So using these devices to where they kind of push into them and they'll get actual numbers. And we can use that. And what's cool about the software that we have is it actually will compare to like the normative data for everybody that's person's like how, their age group. So it's not just saying like, oh, like here's your number, move on. It's like, no, like this is where you compare, to everybody your age that's ever done this test. Like this is what we're able to compare it to. So it kind of helps us get a good baseline of where that individual is. And then, use that information again to try to decide, is this meaningful? Is this not meaningful? We're trying to take a good big picture approach and not just like really nitpick somebody. If we see somebody come in and maybe their landing mechanics are really not good, and then their strength is like maybe they've got a 40% strength deficit from their right leg versus their left leg. That's probably somebody we're going to want to like flag and probably follow up with and just kind of communicate with them and the family of, hey, try doing this or try seeking this out to try to again make a difference before it could be potentially a bigger issue. And again, these tests are not going to say that this person will get injured. These tests are being used to get a good understanding of where that athlete is at so that we can enhance their performance and hopefully reduce their risk of getting hurt. Like that's again the goal. But these tests are not just because you don't do well on the test, that doesn't mean you're going to get hurt. Especially if it's like it's your first time ever doing the test. We want to make sure that you've actually learned how to do the test and we're not getting this like false number. So I'll just kind of start with that and I'll let Spencer dive into a little bit more as well.
Yeah.
Yeah, and it's very cool. I actually had a 13-year-old come in today and do just like a preventative evaluation. So, and it, like Zach said, it's basically just a screening for if there's any weaknesses that they might have from a strength deficit or if like one certain side is a little bit weaker than the other. And those are kind of the big things that we look at. And a kind of metaphor that I like to use is like our muscles are there for armor. They're not there as like our safety net. So like the more we strengthen them, the stronger that we get, theoretically the lower our risk of injury should be, right? So, and obviously there's a plateau to that eventually, right? Like there's some Saquon Barkley tore his ACL and his quads are massive, right? So it's not our safety net, meaning like it's not going to prevent it completely, but we just know that if you're a little bit stronger in certain areas, then your reduction is of injury is a lot better. So but yeah, so like I said, she came in though today and we kind of just run them through essentially a performative testing battery. And we're almost, I mean, it's the exact same we would do for just a performance test for an injury reduction test. But what we do is we kind of take all that information and we dive into it and we again look at those normative data that Zach was talking about. And if their hamstrings are in the 30th percentile compared to like someone that is their age, that's kind of one of those flags that pop up for us and say like, hey, you're good, like symmetry, like your left and right are the same, but like you're very weak here. And like for hamstrings specifically, if you're weaker in your hamstrings, you have obviously a much greater risk of like a tear is extreme, but like a pulled hammy or something like that. So especially if they're an athlete that's a little bit like quicker, like more of that like faster athlete that might be like a winger or an outside back. So we can get a little bit positional specific and stuff like that too. But that is really useful, like Zach was saying, with all that equipment that we use. And we have taken it to a lot of teams, collegiate teams, youth teams, and we've ran these teams through tests that kind of attribute to their sport a little bit more specifically, which is very nice. Because we can just change the testing battery, but it's very efficient too. So it doesn't take much time out of their team's practice. And it gives us some good, solid information to hopefully catch anything like we've been talking about. Or if they've been dealing with something, we can see kind of where their progress is with that too. So again, my athlete that I had earlier, she had some like kind of recurring ankle pain that she was kind of curious to get checked out. So we took a little bit deeper dive into her ankles and her calf strength and stuff like that too. And then also from a preventative side too, something that we're starting to dabble in a little bit is, and obviously soccer athletes know a little bit more about this, but it's some of that GPS tracking and monitoring. So we're trying to use it more so with some of our patients coming back from injury to make sure we're not overloading their system too much, and they go back and do everything all at once, and then they're back to ground zero. So we're trying to gradually progress them from not only just in the clinic and strength work, but we're also trying to see how much they're actually doing when they go and play their sport too. Again, this is something from a preventative side of things where if we would be able to see that information, if you had two games one weekend and then you had a weekend off, and then that following weekend you had another two games and three practices, and you went to a technical training, and their total volume of like running jumped like 30% right there. That's a key for us to say, like, that's a little bit too much. You probably shouldn't be doing that extra technical training, or maybe we should back off and practice a little bit because you really don't want to see anything greater than like a 5 to 10% jump from week to week. And especially when you're in mid-season, your body's starting to break down. So those are some kind of key flags that we can look at and say, all right, this is where we should be this week. And so now they're going into that following week with a plan of how many miles they should be running, how many sprints they should be doing, and they kind of have an understanding of that. So again, we're just trying to minimize the risk of injury, not necessarily prevent it all at once.
Okay. So if
Yeah,
I
I'll
did,
kind of add to that too, as far as kind of going back to when you asked the question of like, what is primal recovery? And
Mhm.
I think that is what Spencer just said, all of that is a perfect representation of what it is our goal was to bring what is being done at the professional level into the private sector.
Okay.
That was the goal, and that is the mission. So this is, and have a lot of colleagues who are working in professional sports. Everything we're talking about, from the testing to the GPS monitoring to just the communication, this is what is being done at the professionals level. And that's where I wanted to bring that into a private sector to where we can have the same tools that are accessible to these professional athletes and provide them to these youth athletes. So I
Okay.
guess that would be a better representation to kind of highlight what is primal recovery, and that's kind of what I would say. So,
Okay. So, when you get someone that does a strength play testing, and it's like, one side's here and one side's there between strongest and then weakest. Are you trying to bring it to symmetry, or are you trying to get it as close to can like I don't think anything can always be symmetric. You know what I'm saying? Like you're never going to get the exact and it's never going to hold because, we're always doing something that's going to maybe strengthen one leg or the other, one hamstring and the other. But when you notice a big balance that's off, are you trying to bring it as close as you can to symmetry?
So the symmetry is a really good question, because the first thing I'd want to consider is what is their sport. Because there's, if they're a baseball player or a basketball player, and maybe they have that dominant side that they push off or
Yep.
jump off of,
Yep.
I already know that there's going to be a asymmetry there that
Hmm.
may be a little bit larger than what we would typically like.
Hmm.
However, when it comes to like the force plate stuff, the good rough estimate that's been well documented is around like a 15% is, within normal.
Okay.
Now when it comes to the strength testing, there's a lot more research to show that yes, we want that to be a
Mhm.
lot closer.
Yeah.
We want to see if we can get, strength to be, within 5% of each other, would be, a pretty good recommendation. But as far as the jumps and all that type of stuff, it's a little bit more variable. And it also is very nervous system dependent. So that's where there's been people who have done one of our jump tests, what's called a counter movement jump, where you go down and jump up as high as you can, you come back down.
Mhm.
There was a guy that did that for 30 days straight, and it just showed the fluctuations just day to day.
Uh-huh.
And we'll get into this later since we're going to talk about recovery stuff, but stressors, internal and external.
Mhm.
Like there's, if you didn't sleep well, your numbers are you're gonna be affected. If you have external stressors, school, work, life things going on, like that's also gonna affect your nervous system. So, and then obviously what Spencer was talking about too, like overall training load is gonna affect your nervous system as well. So it's also being used in the professional level,
Mhm.
as an indicator of nervous system readiness and if we need to shut a person down. So a
Mhm.
lot of these teams are actually doing this test like match day -2 or -3 to try to capture it before they get into the weekend, because if they're going to be getting closer to their game and this guy's, his nervous system shot, well, maybe that next training day they kind of shut him down or just decrease his workload to try to get him ready for the upcoming match. So that's kind of how it's being implemented at like the MLS, the Premier League, and it's really an effective way. So it's not just how high can you jump; it's how ready are you.
Yeah.
And so it's been really reliable from a nervous system readiness perspective as well.
Yeah. Interesting. So essentially, we should all do meditation, namaste, and all that stuff, yoga, right?
All good.
Yeah.
Yep.
Yeah. Okay. Fair enough. Fair enough. Yeah. Uh, Okay, so you mentioned the sleeping patterns. It can mess stuff up. And we talked about before, you were telling me about there was a great study you had read about sleeping patterns and how it can lead to high injury prevention. Let's go into that. How important is it? 6, 8 hours of sleep. I mean, they always say 8, some say 6 in the middle. What's the right amount of sleep you need, and how does your sleeping well prevent injuries?
Yeah. Another one, or I'll just start off by saying it really depends on the age of the
Okay.
person
Yeah.
too. The younger, they should be sleeping way more. I would say probably between 10 and 12. If you're between like the ages of like, I guess most people are probably playing competitive soccer nowadays around what, 8 years old, 9 years old ish,
Yeah.
maybe a little higher, but I would say between, let's just call it 7 to 13, you
Mhm.
should be for sure 10 to 12. And then, from
Hours?
hours. Yeah.
Wow.
Yeah.
Wow.
From,
So like 8 o'clock bedtime to like 8 o'clock the next day or 7 or something, right?
oh
Sounds like
yeah.
yeah,
Like that would be a really good recommendation
yeah,
for those younger athletes.
yeah,
Younger kids they need more sleep.
yeah.
Now, when we're getting into kind of this mid-range, kind of high school-ish range, I would say definitely between 8 and 10 would be
Okay.
recommended.
Okay.
Now, what are most kids doing? Probably 6 or less.
Wow.
And that's something we can even get into like a sleep hygiene, what you should be doing before bed to make sure your sleep is actually effective.
Sure.
But that's one thing I would say flat out. Like if you're a high school kid, you should be shooting for 8 to 10. You know, if you're lower than, 13 years old, I would be pushing, 10 to 12. Um, yeah, naps are effective as well, but I would definitely say obviously with schedule, that's what is really hard. Schedule and school, and there's so many variables, practice times and stuff to where a lot of these kids are not getting that. That's like the best case scenario though, right? Like
Mhm.
research just shows that. Is
Yeah.
that realistic? Probably not. But if we can at least ballpark it and get between, 7 to 10 hours, that's probably a good spot to be. What research is showing is that when you get below six and you get below six consistently,
Mhm.
that's where your risks of injuries are going to go up. There was a study that was done years back. I can't remember the exact author's name, but it showed that they called chronic sleep deprivation 3 days. So 3 days is what they called chronic, which I thought was funny.
Yeah.
But 3 days of less than 6 hours of sleep increased by 2.3 times increased risk of injury when you slept less than 6 hours on 3 days consecutively.
Wow.
So when we think about a lot of these kids, I'm sure a lot of them probably fall within that bucket.
Mhm.
And again, it's not to say that, yep, just because you slept 6 hours today, you're going to go get hurt.
Sure.
But we just need to respect the fact of how important sleep actually is, and you shouldn't take it lightly. And that starts with how you prepare for bed. And we can obviously get into different strategies for that.
Yeah, let's kind of talk about that. I mean, I read different stuff, eat certain types of fruit before you go to bed, yogi herbal tea, all that fun stuff. You know what I'm saying for older adults. What's a good sleep hygiene? And we can talk about let's start with the young kids, into high school. For the young ones, what's a good sleep hygiene? I imagine no screen time for a certain time before you go to bed, right? I would imagine that's one of the top on the list.
Yeah, I'll let Spencer start this one.
Yeah.
Yeah, and one thing too that I just want to add is like obviously we're rehab professionals, so we're coming at it from an injury perspective,
Yeah.
but
Yeah.
I think what might honestly be more appreciated is like from a performance standpoint, like everything that Zach just mentioned, obviously increases our chance of getting injured, but it also decreases our performance. So,
Yeah.
especially for these athletes listening, it's like if you truly want the most success, like doing these things properly are going to set you up for that. And this is kind of where it starts. Like this is the foundation. So these little things do matter, and they matter from a performance side as well. But yeah, I mean, I think just as a general rule of thumb for like a good bed routine is obviously like putting the phone down, putting the screen away, the console, whatever you're playing on, PC, whatever.
Mhm.
But just that blue light isn't obviously the best thing before. Like it's you're raising the cortisol, the stress levels are going up, right? You're keeping your brain active. It doesn't have any time to calm down. So anytime you can get away from the screen and meditate if you want to do
Yeah.
that, like you're saying, or
Yeah. Read a
anything
book,
else,
right?
read a book. Yep,
Yeah.
read a book's perfect.
Yeah.
But yeah, anything you can do to get away from a screen for I think I would say I don't know if there's any research, but I mean sure there is, but I'd say like at least 30 minutes, just set that phone down. Um, and obviously too, just a big thing is not eating like snacking early on too, because again, that's going to just like increase that nervous system. And when we're going to sleep, we want to have it's called down regulation, and we want to be in a calm state. And when we eat, it kind of spikes that nervous system up too. So having some time before dinner and then not having some snacks and stuff before that is pretty important too. And then just from a sleep quality standpoint, right? We typically you just want a dark room and you want it to be cooler than like your body temperature. I'm sure everyone has woken up just because they've been sweating at some point and it's not the most comfortable thing in the world. So trying to find like a good cool temperature that works for you is really important. But I think those are the main ones, like the heavy hitters. Obviously there's like other techniques and stuff you can do if there's like white noise and all that stuff too. But I think mainly like I said, the screen time is a really big one. The temperature is a big one, and then kind of some of that like snacking and stuff. Again, we're just trying to calm that body down before we go to bed. Because if we go to bed in that like upregulated state and that nervous system's kind of firing and stuff, the quality of sleep is actually decreased.
Yeah. You know what's funny is like all those I feel like relate to stress in some way.
Yeah.
Like
Hmm.
people stress eat, people stress go through their phone.
Yeah.
We're so connected nowadays. It
Yeah.
sounds like you just gotta let the day go and you just gotta, before bed, 30, 45 minutes, just shut the brain off. That's essentially what you're saying.
Yeah.
100%. Yeah.
Yeah. I'll also add to that as far as especially because I'm sure some listeners might be in that high school, college range.
Mhm.
Um, the hardest part is the late night trainings and games.
Yeah.
That's something where, again, going to this point of like when you play, your nervous system is amplified. So something that'll be very effective for individuals who might have those sessions. I know when I was in high school, I didn't get off the pitch until 10 p.m. sometimes.
Yeah.
So coming down from that is tough, and if you go home and you eat right away at 11 p.m., now we're talking about that's going to affect my sleep as well. But how do I get my nervous system to calm down the fastest? And that's where like there's a lot of different deep breathing techniques that you can do that I highly encourage people looking into for those specific situations where if you're working out late at night, if you're training, you have games late at night, get into some deep breathing, afterwards to try to help bring that nervous system down as quick as you can. And that could be also effective just for people who might be a little bit more awake at night, or have a difficult time falling asleep. Just deep breathing is very, very effective as a way that you can add to your toolkit to try to shut the brain down. But I think the best piece of advice for, anything to improve just overall nervous system fatigue and alertness and stuff and shutting your brain off is just completely disconnecting.
Yeah.
Just disconnect from your phone, for a few hours and just let the brain calm. Go out in nature, like
Mhm.
just be present, be away from all the technology, and that can make a huge difference. Just in overall mood, alertness and energy. Because again, when we're connected to here, it can become this vicious cycle and this energy draining vampire.
Yep. So let's pivot to, we mentioned food a little bit. I know you guys aren't dietitians, but obviously going through school, I mean, you learn a little bit of it. Obviously, you have probably friends in the field you speak with, or if you've gone to a conference, it gets covered a little bit in what you guys do. Just some basic stuff of like, balanced diet, eat your greens, eat the rainbow. Is that the type of stuff we're looking at, or is it more than just eating the rainbow? Is it more proteins? Is it, tell me, I'm interested.
Yeah, I think the last part you said was the biggest is just like protein. I think when you look at it, and obviously like this can get a little tricky, especially with like high school, college age and stuff, because you don't want your life to revolve around food. It's a tool for us, and obviously we need it, and you want to be able to enjoy it and stuff too.
Yeah.
So there's always a healthy balance of it, but I think just making sure you're getting enough of certain things is as simple as it has to be. It doesn't have to be the fanciest meal every single time, but I think the biggest thing that we don't do as just a society in general and athletes specifically is have enough protein.
Mm,
And I think using supplementation is awesome for that, like whether that's protein powders or protein shakes.
mhm,
I mean, there's a variety of ways that you're able to do that. But like a pretty standard like rule of thumb is just kind of having it's essentially like your body weight in grams of protein.
mhm,
So for example, like if you're trying to build muscle too, you're probably going to want a little bit more than that. And being like a little bit under that is okay too. But I think what you'll find is a lot of these athletes, high school, college level, and even a little bit younger too, like they're maybe getting like half of that. And that is stuff that from again a performance side and injury rehab side, when you're actually trying to get back to playing, it's like you need that fuel to be able to get stronger and get more explosive and get more powerful and stuff. So I think that's a very big missed portion of everybody's diet, not even just athletes. But again, there's so many protein bars, like there's so many different things that we can do just to get that extra protein in. I think that's a big one. And then the other thing that we preach a lot to just our rehab patients, and obviously making sure that you're old enough to do that and mature enough to monitor it is a creatine is a supplement that we like to use a lot too. And same reason as kind of the protein. It just really helps to like put on some of that size and get some of that strength a little bit quicker. So and it can help with like brain function and all that stuff too. So those are really the two like main things that I like to educate patients on from that side of things. And obviously everything else goes the same. Like you from an athlete's perspective, you're going to be burning a lot of calories. So just making sure you're eating enough calories in general too. But you can get into like the macros of like the carbs and the fats and stuff too. But it depends on what sport. Like if you're more of an endurance sport like soccer, you're gonna need to have a lot of carbohydrates. So potatoes, rice, bread, all that stuff. Like that's the good stuff too. People tend to not have too many issues having those. But yeah, I think a big thing is just making sure we're having enough because I think underfueling is a lot more common in athletes than overfueling. So from a very foundational level, like that's the biggest takeaway I would get from this.
Yeah, carbs are good.
Yeah.
I would
That's
say also like just to kind of add on the carbs as well as like when you think about like pre-game and like maybe mid-game and then post-game, you can kind of break your carbs into three different types. And you think your pre-game and your mid-game is more as those quick sugars,
Mhm.
Yeah.
so whether it's like juices or honey or some fruit to where it
Chocolate
just gets
milk.
into your system. Yeah.
Yeah. It's actually
Mid-game
really good for
thing.
you.
Yeah.
People don't think
I
so, but it's actually good recovery. Yeah.
yeah.
100%.
I
Yeah.
But yeah, I mean it's one of those things that like you're like Spencer said, you're running so much, your energy just gets depleted. So like mid game, you might have to,
Yep.
eat some fruit, something just to get your blood sugar up again. And then afterwards you can definitely obviously dive into more of like, what he said, like those more complex ones, the rice, the potatoes, the breads, whatever. But carbs are fuel.
Yeah.
So don't be afraid to eat those.
Yeah.
Yeah.
Before we shift into talking about like how stress can help, stress, managing stress can help prevent injuries and, actual warm up before a match, your pregame stuff you do with the older athletes. So let's say college students for this subject here, alcohol. Like, shouldn't do it before, I don't know if you guys have come across this or spoken with your college athletes about this stuff, or you guys have had to. Listen, we've all been in college, listen, we've all wanted to go out with the team after and everything. But in season, how important is it to kind of lay off that? And I imagine some of that can lead to injuries.
Yeah. You want to take it, Zach?
You go ahead. I was gonna say.
Yeah. I mean,
You
it's the
Oakland boys, you Oakland boys are
oh,
popping those beers before games.
Yeah.
hey, haven't
Michigan
lost
State
in 10
wasn't
years.
any we're the party school too. So,
Yeah,
yeah,
that's
talk to
fair.
Craig about that one,
That's fair. Yeah, I mean it's the same as everything else. I mean, there's really only cons to it, to be quite honest with you. I mean, there's some pros, but they're not from the performance standpoint.
Yeah.
But yeah, I mean it goes with any other thing that's bad for you, right? Like it increases our risk of injury and decreases our performance, and it like obviously there's a certain time frame like leading up to a game. I probably like 48 hours or so.
Wow.
But if you think about it, the way the college schedule is structured, having two games in a week, it's like you don't really have too much time to get that out of your system
Yep.
while you're trying to still stay sharp in or in midweek form. So like
Mhm.
obviously not the smartest idea to be consuming, but college is college, so people are gonna want to have their fun, but again, just you have to know, it's just a decision that you're gonna have to make and you're gonna have to live with the next couple days. So just be smart when you're gonna do it if you're gonna do it.
Yeah.
Yeah, I would just add to the biggest thing from just like the science side of it is like going back to increasing risk of injury. One big part of it is the fact that it just it crushes your sleep cycles.
Uh,
So you're not actually getting into good restorative sleep. So that's one of the big effects. So like obviously I would really hope you're not going to do it before a game, a day before a game. But yeah, I've spent like Spencer said, I mean, definitely the timing of it would be something you definitely want to take into consideration.
For
Uh,
sure. You know,
but like you said, though, I mean, college is college, and I know like a lot of us, stayed away from it for the most part during season, but obviously we had our fun. But
sure.
um, no,
What I'll add to real quick, just again from a rehab side of things, is it alcohol is an inflammatory, meaning it like swelling wise, it's going to just enhance that and create more. So
Mhm.
if you're injured, right? So again, we work a lot with ACL injuries, and one of the biggest things that we educate them on is getting swelling out of there.
Mhm.
So if you're recovering from any injury and you have swelling around an area and you go out and you do partake in that, like again, you just have to know and understand that swelling is probably going to be a lot worse that next day and take a little bit longer. So
Yeah.
from a rehab side of things, it's just like it's kind of set you back a little bit. So again, just it's all a decision though, up to the individual.
It's choices for sure. Choices in life and the decisions you make, right? And you got to live with them. Let's jump into before we jump into the warm up, before you play the game or match. How about the stress? So, how much does stress from school, anxiety, bringing those stress levels down? Obviously, that kind of correlates with sleep, but how much is it to control your stress helpful to prevent injuries?
I mean, a lot. Like we've already kind of dove into it with like the nervous system enhancement and things like that. But I think something to note here though is like stress isn't always bad. There's obviously good types of it, right? Like if you have a presentation or a project or an exam, you have that little bit of that stress to prep you for it. Same thing with the game. Like games are stressful, they're intense, but sometimes that stress kind of brings out that enhancement of performance inside of you. Now, when dealing with it from again an injury standpoint or even a performance standpoint, maybe you do have a few exams stacked back to back in school and maybe something on the like external relationships or something like that aren't going well and that's kind of coming at you from a different angle and stuff like that. So we've talked about food, we talked about sleep and all that stuff too. So that will obviously always impact stress. So I think the biggest thing from an athlete's perspective and honestly a parent's perspective too is to kind of circle back and look at it from more than just what that incident may be. So maybe they had a bad game and they're looking at it from just that incident and they made a bad play or something like that. But if you take a step out, maybe these last 2 weeks they were going through midterms or something like that, and just having that realization that it's not just a singular moment, it's the whole grand scheme of all that, and that's not going to reoccur throughout the entire season or whatever it might be, I think is very valuable and important. So I think we can just get stuck on like certain aspects of our performance, and we just need to take that little step back and look at it from a bigger picture.
Mhm.
Yeah.
Yeah, and I'll just add that I think it's
Yeah.
one thing that we'll ask a lot of our athletes too, just like, whether it's through our app or just in person is, how ready do you feel today and not just about your pain. I think that the pain's one thing, but like, how'd you sleep? How's your energy? Like, what's going on with you this week from like, again, external, like life, school? Is there anything that we need to know? Because again, if I just add more, stress onto this person, it may not be the best thing for them.
Yeah.
So having it opens the door for a conversation with that athlete of just like really understanding where they're at and hopefully you've built a good rapport with them to where they're actually honest with you.
Yeah.
If they're like, man, like I had a kid come in today, he's like, I'm cooked. Like he's like, I had so many exams this past week, I'm dead, and it's like, okay, that completely changed my plan for the day.
Mhm.
And I think being a rehab in our role, we have to be flexible. We have to be able to adapt because we have a lot of athletes who are in that high school to college range who are dealing with a lot of stressors.
Yeah.
And we need to be able to adapt so that again, we can do what's best for them and not just check off what we had on our game plan for the day. It could be completely different depending on how that person comes in today.
Yeah.
Even though I wish it was a perfect world, but unfortunately, it's just not.
Sometimes just those regressions are actually progress,
Yeah.
like like Zach was saying, if you have someone that comes in a little sluggish, like they might not be moving the weight that they're supposed to be lifting at the same rate that they were 2 days ago. But like at the end of the day, they're still getting work in, and you're kind of setting them up for the next couple days rather than punishing them for being sluggish that day.
Yeah.
Yeah. It's kind of like the saying, like it's, sometimes, the best thing you do is just show up, and it's okay if you don't give 110%. I mean, it's interesting. You guys are physical therapists, but in not quite the sense, you're not really an actual therapist, like that asks people, but you're playing that role a little bit because you got to figure out what your patient's going through in some aspect. And then you pivot off how they feel and what they can handle. And, I think a lot of that honestly is, I mean, I hate to say it, but a lot of, college, it's better because you're hooked up to monitors and everything and they track stuff. But unfortunately, in the youth game, it's like I'm a youth coach. I've run a session. Some of them don't ask all 18 players, "How are you today?" "Oh, you can't go do
Yeah.
this and do this, exert much force because you're going through something or whatever." Like, it's interesting to hear about this. It's just a
Yeah.
different perspective, right? Which is
For
interesting.
sure. What I'll add to real quick
Yeah.
is, and this is something that Zach and I have started doing a little bit more is sports psychology, and I
Yeah.
think we were fortunate enough to know a really good one in the area and stuff, and we have started to kind of shuttle all of our patients in that direction. And the reason why is, and he explained this in a very good way to us, and it was basically like if you look at success in kind of a vacuum, you have the physical side and then you have the mental side. And really, like those are the two key components of success, right? And I think a lot of probably our listeners and things like in the audience and stuff are super, super focused on that physical side. And they're kind of tapping out that entire side of the equation. But when we search from a mental side, like when it's kind of untouched, right? And so obviously it's that math equation. The more we increase that mental side of things and the physical side, we're going to have more success. And so whether that's from like a confidence standpoint from a player on the field or whatever it may be, like working on that mental side of things is actually super important. And part of that is dealing with the stress that we're talking about. And it could be actually like on the field. It could be like something that your coach is pressuring you to do or your teammates or potentially could be just your performance in general. Or it could be some of those outside of the field situations and dilemmas too. So that's something that it's sometimes gets a bad rep when we talk about like that mental health therapist and things like that from a sports psych thing. But I think using it as again more of a performative approach is the direction that we need to start pushing people in because ultimately that's really what it is.
Yeah. All right. The last for this, how we can prevent injury before it happens. Let's go with right before you start the game, just leading up to it. Obviously, making sure you're hydrated is, the basic stuff, with the electrolytes and the fluids, but even more so, the dynamic you do before the game. I mean, listen, everyone does different things when I scout. Like people use bands, people, obviously there's very much different types of way. Each team warms up differently that I watch all the time because I'm always there early for warm-ups. And, what's the best way to handle a pre-match, pre-game warm-up to make sure you prevent injury?
Well, what's funny is I don't think you've scouted the over 30s, and maybe it's because you actually show up before the players do. And then when they do show up, there's a bunch of beers, getting handed out. But yeah, I'll say don't ever take advice from the over 30 group because
Yeah.
that's not a good warm up. And then guess what? There's a lot of injuries.
Yeah.
But yeah, I think there's one of our colleagues, Lisa Barone, who's now the performance coach for the DCFC men's team now.
Yeah.
She was at Michigan State. She's incredible. She's really been pushing this, and she gave me a really good presentation last year on her philosophy with the Michigan State crew, and really like it came down to the whole purpose of the warm up is to get the nervous system actually ready. And unfortunately, when we look at most traditional warm ups, I'm hopeful to say that most have moved away from like a static stretching type of thing. And again, static stretching still has a place,
Yeah.
but prior to a game, probably not the best thing to do. We want what's called, the dynamic, but I would even dive deeper into that and say that most people are still not even doing an effective dynamic warm up. People are just going through the motions, doing the thing that they've just been taught for, the past few years, but they're not even breaking a sweat. Their heart rate's not even getting elevated. Their brain connection, it's just not there. And then you step on the field, and then coaches wonder why the first half looks so sluggish.
Mhm.
And that's where it's like, again, you have to ramp up that nervous system. You got to get the brain firing, the blood pumping, getting a sweat, getting people moving. And I think that that's the biggest thing when it comes to warm-ups is that we're just not, the intensity is just not there. It's more of a, okay, we checked the box, we warmed up. But are the players actually really in tune, fired up, doing passing patterns, whatever it is, little side games, and getting things going to where they're feeling sharp?
Yeah.
I think that that's a big thing that is often missed. And again, I think that well, I just mentioned before earlier, there was a study that came out this past week that actually showed it was about ACL injuries. And everybody's blamed, oh, it's when people get tired and fatigued and it's later in the game. And it actually showed that most injuries occurred in the first half.
Yeah.
And it just, again, I'm not saying that this is a complete correlation, but one of the theories was that we actually weren't like that people weren't warmed up, they weren't ready, they weren't primed. And that's something that could be because I anecdotally that's what I've seen too. Most of the injuries that I've dealt with, like from the individuals coming to me from an ACL standpoint, a lot of them did happen in the first half of the game. I had only a couple that were later in the game, and but that's not been the majority. So again, there might be something to it, but again, I think it comes back to we got to do a better job of actually getting these players warmed up.
Yeah. So what I find interesting, honestly, when I go to matches is it's the starters doing everything, and then all the bench guys are sitting in a circle playing rondo, like for soccer at least. It's the typical one I always see, and no lie, there's very few
Yeah,
teams I see where all 25 guys are doing the same warm up, and then
yeah.
everyone splits and does their stuff, you know. But then the workout intense is before they sub in. It's like go warm up. All right, it's going to take you 15 minutes to warm up, and like from your perspective, is that good if you don't start with the intense warm up before the match and then all of a sudden, you're coming in halfway through the first half but you're spending like 15 minutes? Like, I feel like that's not very good, to be honest with you. You should start right from when you walk on the field is when the intention should start. And then, not halfway through before 10 minutes before you get subbed on in the first half or second half.
Yeah, and I think a lot of people would argue, well, oh, I'm going to get cold though. And I think that okay, maybe and then maybe you just, like you said, 10 minutes you go warm up, but I think it goes beyond that. I think it a lot again, I think I'm looking at it more from the nervous system at this point,
Yeah.
where I think that even if you're not going to be a starter, I think just getting your mindset ready that you're going to play, you're getting the touches, you're moving the ball, and you're acting like you're going to be starting that game. I think that that is way more beneficial than doing nothing and just playing rondo and then, just doing which I know I've seen them for a majority of the players, their little 10-minute warm up where they're just kind of standing there, shifting their hips side to side, kicking the ball, whatever.
Yep.
They're not actually warming up, maybe do a couple sprints. But again, like I think that I would take it from the standpoint of like, I want every player included,
Mhm.
and then even if you are coming in the game, even if you're not playing,
Correct.
just get out there and just get into the game,
Yeah.
get ready. I think that even if you're not going to play, who cares? Get out there, break a sweat,
Mhm.
get your mind right. I think that's what's more effective is getting that part correct.
Mhm. Interesting. Spence, anything to add?
No, that's pretty much it. I mean, it's called a warm up for a reason. If you're if you're not breaking the sweat before, there's an issue with it. So
Yeah. Well, this is our first episode here. So we talked about how you can help prevent an injury before the injury. So thank you, Zach and Spencer. Much appreciated. Look out for our other awesome episodes that'll be releasing. And again, thank you, Spence and Zach.
Thanks
thank you.
again, Brooks. Appreciate it.
You're welcome.